All right, so let's make up a little bit of time here. I want to make the intro quick. The purpose of this panel is to give you a little bit of insight into veteran service organizations, the value that they can provide VA, and some of their perspectives on immersive technology. So as Evan, I believe, mentioned, I have a background in patient experience. I was at the VISN level as a patient experience officer for a few years there. And I think that most of us, I mean, there's a lot of VA in the room, of course, most of us in VA, I think, are understanding that we continue to do a better and better job of getting veteran input when it comes to the things that we do, right? So whether that's veteran satisfaction, maybe getting input on the front end, when we're developing solutions for veterans, we do better and better at that all of the time. The reality of it is that when we are getting those veteran perspectives, it's usually the perspectives of veterans that are currently receiving care from VA, right? And these are very important perspectives, obviously, but it's not the whole picture. And if we look down the road, future, present and future military engagements require less and less people, which means that down the road there will be fewer and fewer veterans, which means that it becomes more and more important that VA services as many veterans as possible, including those who do not currently rely on VA for their medical care. We need to meet the needs of those individuals and bring them into our care as well. And so it has never been more important for VA to be looking at the perspectives and the needs and the challenges of veterans who do not yet receive VA care. There is no better aggregator of veteran perspectives, needs, desires, values than the veteran service organization community. And I'm very fortunate to have three leaders in that space with me on the panel here today. I'll give them an opportunity to introduce themselves here in a moment, but just wanted to point out that this is an absolutely crucial community for us as VA to be engaging. We have been, kind of speed this along here, we as Evan had mentioned, we've done a lot of engagement working to build relationships with VSOs over the last couple of years. We are on the ground at their national conventions talking to hundreds of veterans. As it relates to immersive, we had, I would say, nearly 1,000 veterans heads in headsets during these summer conventions last year. Summer and there were a couple that were outside of the summer, but you get the idea, don't you? Lots of veterans in headsets. And we saw some really powerful testimonials from veterans and the impact of immersive technology, even with many of these veterans, as their first experience in a headset. So really excited to have these folks here. I also wanted to, we have VFW in the crowd. They're not here on the panel, but they're here. They've been hanging and slanging with us all day. Marion Farah and Catherine Cassell, really happy. Thank you so much for being here. Really appreciate that. But I'm going to hand it off to our panelists here. If we just go down the line and introduce yourselves. And actually, so on the Whova app, somebody was looking for bonus points today and decided to submit a question to us. So as you introduce yourself, your name, title, organization, and then the question that came in for each of you to answer, what year was your organization founded? I'm putting you on the spot here, John. Can you do it?
Sure can.
He can do it. All right.
I appreciate the invitation, and DAV is really grateful to be here to partner with you all. Especially, we want to send our thanks to what you do every day, and especially in the innovation and research and the healthcare side. And I'm John Retzer, Assistant National Legislative Director, and my portfolio is overseeing the Veterans Health Care Administration's needs to ensure that they're able to provide direct care and coordinate the care amongst the community when needed. So DAV has been around since 1920. But actually, we have an interesting story because it was actually the Christmas before 1919 that we had our founders come to a meeting at Christmas time and say, we need an organization that takes care of injured and ill veterans. So, but our birthday is actually 1920.
Thank you. Good afternoon. My name is John Eaton. I serve as the Vice President of Complex Care at Wounded Warrior Project. I've been with the organization for 2 years, and my portfolio represents the breadth of our mental health continuum of support, from adventure-based programming all the way through to our clinical interventions with partners very close, like the VA. Year the organization was founded was in 2003.
Nailed it.
It's a hard act to follow. Hi, I'm Tiffany Ellett. I am the Division Director for Veteran Affairs Division at the American Legion. I've been there for 3 years, and I'm just really excited to be here. I've been working with Matt in the OHIL office for over 2.5 years. And so we've built a really good relationship, and he's come to our conventions, and our members just love him. And as far as when we were created is 1919 in France.
All right. So we've got Disabled American Veterans, Wounded Warrior Project, the American Legion, 2 Johns and a Tiffany. Fantastic panel here. Thanks a lot for being with us today. I want to pitch the first question here to John Retzer. As I mentioned, and as I think many of us understand here in this room, one of the big benefits of being a VSO is that you get a lot of interfacing with veterans. You get an idea of what's important to them, what do they need. So my question is, when it comes to talking to veterans on the front line, so to speak, what are you hearing from veterans? Are there any specific areas of interest that, for your members with regard to immersive technologies?
Yeah, thank you, Matt. So as we deal with our veterans out there from the advocacy side, our national service officers around the country hear about not only the benefits challenges, but they want to understand the healthcare challenges. Our veterans are explaining to us, and even our members, we have over 1 million members, and they passed a resolution with regards to research and innovations to continue to have VA look for options of care. So being that we look at our demographics from, our older veterans all the way up to our OEF in Afghanistan, what we found out in the immersive technology component is our veterans want options that actually are outside the traditional applications of clinical care. And what that means is the integration of using social media platforms, integration of gaming, so that they have that ability to connect with society. I think one thing that we all would agree on is the pandemic taught us that part, the isolation factors. So what we learned from the pandemic in the most recent time was our veterans said, "I'm lonely." So we have the compassionate, care components that are out there, and you guys have another innovation that's in that same direction. But that is what we are hearing, and it's not just one demographic saying that's what they want. No one likes to be lonely. People, when they are lonely, they're dealing with their injuries and illnesses, and they're suffering. But one thing that we learned through the innovations that VA has done, that you guys have done, like telehealth, being able to connect them with the tablets and be able to video and see their doctors was a huge plus. But now we're seeing that in the innovation components with immersion, that we are starting a gaming platform. So DAV actually does that, and we're getting feedback from them like, wow, this is helping me. And what we're seeing is that not only are they saying that I'm able to find resources to get to benefits in healthcare, but I have a way to communicate and share my story, and also for people to share their stories with them.
Yeah, that's great. Tiffany, same question for you. What are you hearing from, and John Eaton, I'm coming at you here soon, bud. Get ready, okay? Tiffany, what are you hearing from the front lines with veterans with regard to immersive?
Well, the American Legion is heavily populated with veterans from Vietnam and Korea and the Cold War, and you wouldn't imagine that a lot of our membership would be down with gaming. But actually, especially after OHIL has come out and talked at our conferences and conventions, we've actually had a lot of interest, and there's several states that are actually creating their own kind of gaming platforms. And we also have members that have gone to VA and asked about virtual reality or immersive technology in supplementing their care that they're getting from VA and from the community. So we have a really high interest in it. I think that's really driven by a lot of our members are concerned about polypharmacy, and especially connected to mental health and suicide prevention. And so they're really looking for any and all ways that we can still take care of our veterans without having to layer on, medications and things like that. The other part that they're looking at, or that we've talked to them about, is actually respite care for our caregivers. So we do work a lot with our caregivers and with the auxiliary, and some of their concerns is that they're too nervous to leave their veteran at home because they have such high need for different types of care. So being able to bring that kind of respite care into the home where you can kind of check out for 5 minutes, without leaving anything and still being able to take care of your veteran is really important to them. So that's really kind of what we're looking at, and a lot of them are really excited to see where it's going to go.
Yeah, great. All right, John, you've been waiting patiently. Let me hit you with something here. So we've heard a lot today about different use cases for VR. We just listened to the OG dropping truth bombs, Dr. Greenleaf. And so, when you think about all these different use cases, whether we're talking about immersive within VA or outside of VA, these take partnerships, collaborations with external organizations. So my curiosity here is, what are some of the use cases that Wounded Warrior Project's working on? And what are some of the organizations that you've been collaborating with to make that happen?
Yeah, Matt, appreciate the question. And so really, starting with the partnership piece, partnerships are key to the work we do as a VCO, and honored to partner deeply with each of those organizations represented today. In particular, one that really stands out is the Warrior Care Network, which in 2016, Wounded Warrior Project partnered with 4 academic medical centers to really pull together and understand how we can evolve, innovate, and advance the treatment for post-traumatic stress disorder. Fast forward 8 years, we've served over 8,000 veterans, and the treatment has evolved from what used to be weekly talk therapy for a year to warriors feeling better faster in just 2 weeks within the program. Within the technology space, a key piece of that type of treatment throughout has been prolonged exposure, which, as you're aware, relies heavily on virtual reality. And so continuing as an organization to invest in that type of intervention and making it even more effective, right? Whether it's not just the virtual component, but the feeling, the smells, and everything that goes into creating those memories that we know are so effective at really making a clinically significant impact in PTSD symptomology. When we look at what's going in the future through that, we think about other technologies such as artificial intelligence, and how can we, a barrier of access or capacity to care, how can we leverage AI in a way that we can engage veterans throughout that continuum? And so one really interesting thing we're excited about is called Socrates. And so historically with cognitive processing therapy, patients go home with a worksheet photocopied probably from the 90s. It's not very engaging, and we find not so much success in adhering to that. So through AI, we're able to leverage Socrates to go through Socratic dialogue with our patients to really help uncover some of the cognitions and ideas and test their beliefs against those, so that when they're coming to therapy, they're even that much more primed to have an impact.
That's tremendous. John Retzer, back to you. We've seen a lot so far today, and you see it elsewhere as well, that one of the most promising use cases for XR technology is mental health. So wanted to get your perspective. What are some of the most exciting uses, applications of XR technology, specifically within the mental health realm?
Yeah, thank you, Matt. I think I'm going to example what we were witnessed and shared by you all last year at our national convention, and that's the virtual reality using the VRs. I'll tell you, our membership thought that was something just phenomenal for them to see the variety of headsets that you guys had, oculars that you were using, to be able to do everything from surgical training to veterans having the ability to actually go into an environment that they may not be able to. And I think one of the important things that we took away from that is having the ability to have a VR. What it does, it gives a veteran independence to be at their home, because we have many of them that can't leave their home due to psychological barriers or physical barriers, so they're housebound. So we really appreciated that part, and then we took it another step level that we're really excited about is the gaming platform. Literally, we have done basically 17 sessions out there in the virtual world where we're using social media like Twitter, or we're using a gaming platform, and just in a short period of time that we've done it, from January to April of this year, we've had over 6 million interactions. That's impressive to see. One, it tells us it's wanted, it's needed, and they're looking for more, because what it showed us in that 6 million, over 6 million, was that over 2 million actually interacted in a way that was very substantial in helping themselves help and get better throughout the process. So this is what we're really excited about. And we love the fact that you're all looking from a clinical and research component to see, can we do this differently and offer them services that they can do in the comfort of their own home. So you guys are just taking what we've learned and continue to grow with it. And we're really excited to watch you all continue to do what you're doing in this world.
Thanks, John. Yeah, and appreciate the the point that you had made about the application of gaming, and really this idea of, because I think there are a lot of us that maybe have experienced the pushback from veterans with this idea of VR headsets. That's a toy and not a tool. And so this is, I think, one example, and DAV has made a significant investment in this community, this idea of not necessarily VR, but gaming as, dare I say it, gaming as healthcare, or a way that can at least get you to that connection that can get you to healthcare. So yeah, great call out there. Tiffany, along the similar lines there, so we talk about this perception of, is it a toy versus a tool? So what are recognizing that there are some in the veteran space who are seeing beyond that and who understand and adopt this as a tool, do you have any thoughts when we do come across that sort of hesitation, that resistance from a veteran thinking that it's a toy and not necessarily a tool? How do we overcome that misperception?
Honestly, I think you're doing it. So you're well on your way of really just exposing. Exposure is probably the best, and working with us VSOs. That way we can facilitate that kind of connection between the truth about these things and the myth. So coming to our conferences, having things like this where we can have a conversation about it and veterans can be involved and hear these things, I think is really the best path forward. And it's just going to take a little bit more time. You've already cracked, kind of the code at the Legion. So that's a huge thing for us to be able to talk to our members and have them actually asking VA for these things. It is just huge in combating that, kind of toy mentality. The other thing is it kind of initiates through gaming, right? So even though gaming isn't, kind of the technology that we're talking about right now, but our, gaming is that initiative, and they're already building communities. They do virtual buddy checks through gaming right now. So it's really, they're kind of building their own communities, which is huge after what COVID did, and just especially for our rural veterans who aren't able to get back into those social group therapy sessions. Like VA hasn't opened them in some places across the country. Our veterans are really just aching to have that connection, and that gaming is able to do that. And it's just a better idea, or a really, we would love to see it virtually, and have that virtual reality creating those kind of social settings and that group therapy where they feel like they're together, but they might be miles apart.
Sure, great. So then, good call there. Thinking about the future, and Tiffany, I want to give you an opportunity to follow up on that thought. Tiffany, what's your vision for the role of XR technology in supporting veterans in healthcare into the future?
The biggest thing is getting it into homes. And something that we support is end of life as comfortable as they can have it. And some veterans want to have that at their house with their family. And really, a safe way to do that would be through that. If there was telemed appointments through those, or kind of that group therapy, especially for individuals who have complex PTSD or TBIs and they're not really comfortable with going out. We'd love to see that in every home. Kind of like the iPad initiative that VA did during COVID. So that would be amazing, having that as respite care, in those homes. The other thing is, thinking on the provider or the clinical side, it would be absolutely incredible if we could use this kind of technology to identify things like CTE prior to imprisonment, prior to death. Sorry, I have personal connections with some veterans who have taken their own life due to those types of things. So I'm going to move on. You guys, sorry.
Sure. No, really appreciate you sharing that potential use case, and I think that, you know, the onus is on us to identify and work with VSOs to identify some of those challenges that maybe are more at the risk of saying niche, might affect a smaller number of veterans, but the potential impact is immense for their lives. So thank you for calling that out. John Eaton, I want to hit you with that same question. What's your vision for the role of XR technology in veterans healthcare moving forward?
Yes, from a vision perspective, particularly to mental health, I think we really have an opportunity, an inflection point in the way that we're providing care. I believe the XR technology paired with AI tools really are going to be the bridge that get us there. And so just thinking about, you know, cancer care as an example, 40 years ago, a diagnosis could have been, you know, a death sentence that now is treated and managed like a chronic condition. And so through innovation, through biomarkers, through really personalized care, we're able to provide high quality care that looks totally different than it did 40 years ago. Mental health on the other side isn't in that perspective, right? And so a lot of it is we're going to try this approach, we're going to try this, see if it works. And so through machine learning, for example, we're piloting now how we're able to identify, based on years of data, your demographics and your unique symptomology, what's the best course of treatment for your particular journey, as well as how do we augment that care throughout the process, understanding that you could fall into the scenario of being a low responder. Roughly 40% of individuals going through care will be. And so bridging the gap through that piece is huge for us. And then really pairing that with, we talk about gaming and really thinking about the metaverse, even areas that, again, seemed like toys years ago. Really now it's showing incredible opportunities for access points to reach veterans that we're not reaching, right? Just so happens that the average age of gamers overlaps, you know, perfectly with the warriors, veterans that are most highest at risk of suicide. And so when we think about leveraging technology, that has to be an access point connection. And the research shows that the connection made through those engagements is just as successful as in person. And so really leaning into and opening up our own sense of what we can do to be more of a personalized model of care for mental health, as well as increase access.
Excellent. So that's it for the questions. I think I'm trying to get us, we're just about on time. Yeah, just a couple minutes over 2:30. So again, wanted to thank each of you so much for taking the time and for lending your perspectives to this. John Retzer, Disabled American Veterans, John Eaton, Wounded Warrior Project, Tiffany Ellett, the American Legion. I know we have a couple of questions and we're running out of time here, so I encourage you to get to us afterward. I think you can submit via Whova. We'd be happy to answer questions that way. I do want to keep us on schedule as much as we can here today, and I appreciate that you want to ask questions, so hit me up, cash me outside. But somebody got it. There was a couple. There's always a couple in the audience. All right. And here I am wasting time that we could have been spending answering questions, so this is really a tap dance for me. Anyway, the last thing that I wanted to drive home here, okay, was that the same sort of idea. I'm bookending it here, right? Veteran service organizations have the ear of veterans who get care at VA and those who do not get care at VA. When VA creates with the voices of veterans as told through the veteran service organizations, the things that we develop are more effective. They are better. We will change more lives if we work together with them as partners, and they are certainly willing and valuable partners for us. So please, and we have some folks here that represent program offices, et cetera, within VA. If you're in that sort of position, I urge you to consider how you could work with VSOs in your respective programs to make veterans' lives better. All right, thanks a lot, everyone. Take care.